Hi everyone, my name is Mark Bates. I'm a metabolic health coach, and today's topic is embracing food as the ultimate prescription, the future of medicine. Did you know that medical schools essentially ignore food as medicine? Medical students spend years memorizing drug mechanisms and surgical techniques. They learn to diagnose rare diseases and interpret complex imaging studies. This is not easy stuff, so my hat's off to anyone who passes medical school. However, most receive virtually no education about nutrition. Yet a comprehensive understanding of nutrition can significantly enhance a medical professional's ability to prevent, manage, and even reverse chronic diseases, thereby improving patient outcomes and reducing healthcare costs. A 2023 survey revealed that 58% of medical students received virtually zero formal nutritional education during 4 years of training. Those who received any instruction averaged just 3 hours per year. This represents a catastrophic blind spot in medical education. The very professionals tasked with treating chronic diseases remain largely ignorant of the most potent therapeutic intervention available, food as medicine. Okay, so let's talk about the clinical awakening. For practicing physicians, the realization often comes gradually. They follow established protocols perfectly, prescribe appropriate medications, and refer to specialists when indicated. Yet their patients continue to suffering. One physician described his awakening while treating a 45-year-old woman with type 2 diabetes. Despite 3 years on metformin, her A1C remained elevated at 8.5. She experienced chronic joint pain requiring daily ibuprofen and described constant brain fog that affected her daily functioning. Standard medical protocols offered little beyond adding more medications or increasing dosages. Instead, he suggested something radical for conventional medicine, a strict low-carbohydrate approach, limiting carbohydrates to under 20 grams daily for 90 days. The results challenged everything he had learned in medical school. Within 6 weeks, her fasting glucose dropped from the 180s to constantly under 120. The joint pain that had plagued her for years completely disappeared, and she stopped taking ibuprofen entirely. Most remarkably, the debilitating brain fog lifted. She described it as someone turning the lights back on in her head. By 3 months, her A1C had fallen to 6.2, her metformin dose was significantly reduced. This transformation occurred not through advanced medical intervention, but by eliminating foods driving her insulin resistance and inflammation. The detective work of personalized nutrition. The story becomes more complex when considering individual variability in food responses. While carbohydrate restriction benefits most people with metabolic dysfunction, some individuals experience inflammatory reactions to specific compounds even when carbohydrates are controlled. This discovery emerged through careful clinical observation. Patients who improved initially on low-carb approaches sometimes plateaued with lingering symptoms. Persistent joint pain, skin problems, digestive issues that conventional testing just couldn't explain. Pattern recognition revealed the culprits. One patient with rheumatoid arthritis saw inflammation markers improve on a ketogenic eating but still experienced flare-ups. Systematic elimination identified nightshade vegetables as triggers. Despite being considered healthy foods, tomatoes, peppers, and eggplant caused inflammatory responses. Another patient with Hashimoto's thyroiditis followed strict ketogenic protocols but struggled with persistent fatigue and brain fog. The trigger was compounded on cruciferous vegetables, that's broccolis, like broccoli and kale. These cases illustrate a fundamental flaw in conventional dietary advice. Medical professionals are trained to provide blanket recommendations without considering biochemical individuality. Some people cannot handle lectins in beans and grains. Others react to oxalates in spinach and almonds. Some cannot process histamines properly. Effective nutritional intervention requires treating each person's food reactions as seriously as any other medical condition. The systematic elimination protocol. Identifying individual food sensitivities requires a methodical approach that most physicians lack time to implement within current healthcare constraints. The most effective protocol begins with what practitioners call a diagnostic carnivore reset. This involves 90 days of consuming only meat, eggs, and water. This reset aims to eliminate virtually every potential inflammatory trigger, providing the cleanest possible baseline for observation and helping to identify specific food sensitivities. This eliminates virtually every potential inflammatory trigger, right? Because meat, and especially ruminant meats, are almost completely absent of any inflammatory triggers. Okay, most patients experience dramatic symptom improvement during this phase because inflammatory compounds from plant foods, processed ingredients, and other potential triggers are entirely removed. The systematic reintroduction phase follows. One food category is added back every 4 to 7 days, not individual foods, but entire categories. Dairy is first, then nuts, then nightshades, and finally, cruciferous vegetables. Patients maintain detailed symptom log tracking energy levels, joint pain, sleep quality, digestive function, and mood changes. Right? The key lies in teaching patients to recognize their inflammatory response patterns. Some experience joint pain within hours. Others develop skin reactions the following day. Some notice brain fog or mood changes appearing 48 to 72 hours later. Everyone's different, right? My daughter's the same way. She's technically not allergic to melons, but if she eats cantaloupe, she starts to get itchy and breaks out within 4 to 5 hours. She has a problem with cantaloupe. We cut it out. It's just that simple. But you can't tell what you're having problems with until you get down to a baseline that is of absolutely almost no inflammatory issues, and that happens to be ruminant animals, beef, lamb, bison, and water. The individual variability is striking. Patients who tolerate dairy without issue cannot consume a single almond without triggering joint pain. Others thrive on vegetables but react severely to any dairy products. Everyone's different. This personalized approach provides patients with a lifelong roadmap to their biology. Okay, real quick, you know the drill here. Please like, subscribe, hit the bell if you want to get notified. It helps the channel a great deal. We appreciate it. Thank you very much. Okay, institutional resistance to clinical evidence. This is a big one. When physicians begin implementing nutritional interventions and documenting patient outcomes, they often encounter significant institutional resistance. This resistance can take many forms, including skepticism from colleagues, questioning from hospital administrators, complaints from dietitians, and scrutiny from insurance companies. It reflects the medical system's preference for standardization, billing codes, and liability protection over individualized root cause solutions. Presenting case studies showing dramatic improvements in inflammatory markers, HbA1c levels, and lipid panels through dietary intervention frequently meets skepticism from colleagues more concerned with theoretical risks than documented clinical outcomes. Hospital administrators question practitioners who deviate from standard care protocols. Dietitians complain about contradictions to established recommendations. Insurance companies scrutinize treatment approaches that fall outside established guidelines. The medical system operates through standardization, billing codes, and liability protection rather than individualized root cause solutions. Intellectual inconsistency becomes apparent when risk tolerance is examined. Colleagues readily prescribe medications with extensive side effect profiles while considering a 90-day elimination diet dangerous. They refer patients for bariatric surgery rather than attempting dietary intervention first. This resistance exists despite mounting evidence supporting nutritional approaches. Research demonstrates that 97% of type 2 diabetes patients experience improved blood glucose control on low-carbohydrate diets, with 51% achieving complete remission. More, there are some groups that have gotten up to 90% remission level, right, by eating a very strict ketogenic diet. So it is possible. The economic forces behind medical orthodoxy. Okay. Understanding institutional resistance requires examining the economic incentives underlying modern healthcare delivery, i.e., follow the money. The current system generates revenue through chronic disease management rather than cures. A diabetic patient produces thousands of dollars annually through medications, monitoring supplies, specialist visits, and eventual complications. Reversing diabetes through dietary intervention in 6 months eliminates this revenue stream. Pharmaceutical companies invest billions in research, marketing, and lobbying to maintain their products as first-line treatments. No equivalent financial force advocates for dietary interventions that cannot be patented. Educational capture extends throughout the medical establishment. Substantial pharmaceutical funding is given to medical schools, continuing education programs, and clinical guidelines. Organizations like the American Diabetes Association accept millions from companies manufacturing diabetes medications, along with all of the money that they receive from companies that produce all the ultra-processed foods that cause diabetes in the first place, or are a major contributor to diabetes in the first place. The chronic disease management market was valued at $675 billion in 2023 and is projected to reach $1.1 trillion by 2029. This massive economic force has trained physicians to follow algorithms rather than think critically. When presented with dramatic patient improvements that contradict their training, many find dismissing the evidence easier than questioning established protocols. In fact, questioning established protocols can be dangerous to their career path because they're judged and graded by how many medications they prescribe and how many interactions they have, interactions being how many tests they perform, stuff like that. If they don't do enough medications, they don't do enough testing, they don't do enough following the protocols, their careers could be in jeopardy because most physicians today are a corporate employee. Okay? They're not independent. Complexity and chronic management benefit the system. Simple, effective solutions that empower patients threaten the entire economic model. So once again, $675 billion for chronic disease management in 2023. $270 billion in pharmaceutical lobbying. This is how much was spent lobbying Congress. $10 billion on dietary intervention research. Almost nothing. And $5 billion on nutritional supplements. There's a lot of money in nutritional supplements that you may or may not need. Okay, practical guidelines for patients. If your doctor tells you that you are pre-diabetic, you have blood markers that are bad, maybe you're a type 2 diabetic based upon the markers. There are things you can do as a patient. Talk with your doctor, but remember, as always, you are the CEO of your own health. You can do things that your doctor may not necessarily agree with because they are controlled by all the big pharma controls that are put in place for doctors, right? So, what you can do, find qualified practitioners, right? Now, this requires specific strategies. You can look for physicians who maintain board certification in their specialty while possessing additional training in functional medicine, integrative medicine, or metabolic health. Search for practitioners aligned with organizations like the Society of Metabolic Health Practitioners, a group I belong to and I've been certified by. or those who have completed training through the Institute for Functional Medicine. I have taken some training from them. I'm not certified by them. Red flags include practitioners immediately recommending expensive supplement protocols. You'll never see me doing that. That is your choice, but I always look for inexpensive supplements if they're called for at all, or proprietary products. Once again, I don't sell a product to you. Okay? Effective nutritional intervention focuses on food first, not supplements. I agree with that completely. When evaluating potential practitioners, ask specific questions. Do they use elimination diets as a diagnostic tool? Have they worked with patients using carnivore or very low carb approach? How do they monitor patients doing dietary interventions? And I can answer all three of those very easily. Practitioners who seem uncomfortable with these questions or default to standard dietary guidelines, likely lack the necessary expertise here. Medical supervision becomes critical during dietary transitions, especially for patients taking medications. Blood sugar medications, blood pressure medications, and diuretics may require rapid adjustment as diet changes take effect. That's why if you're going to take on a major dietary change, I always suggest you keep your doctor informed and you check in with them often as you're making these adjustments because they may need to change the medications you're on. Okay? Patients have ended up in emergency rooms with hypoglycemia because diabetes medications weren't adjusted as their dietary improvements occurred. Hypoglycemia is having too low of a blood sugar, right? Once again, do check in with your doctor. Make sure that they know you're making this type of a change, but make sure you're also measuring your performance and establishing for yourself that you're healthy. You're in charge of your own health, ultimately. Okay? Baseline laboratory work should include comprehensive metabolic panels, lipid panels, inflammatory markers, and thyroid function studies. Do make sure your doctor looks at those, but also understand your doctors are trained to look at the ranges that the labs provide them, and those ranges are based on sick people, not optimal ranges. So we may be able to discuss where your ranges might be better off in someplace else. Always talk with your doctor. For patients unable to immediately locate a qualified practitioner, less extreme approaches such as strict low-carb eating under 20 grams daily provide a safer starting point while searching for proper medical guidance. Once again, I'm not diagnosing any diseases. I'm just offering you a metabolic approach to a whole body health program that will affect a lot of different types of diseases you may have, but let's keep your doctor in the loop on all of this. Okay, the inevitable transformation. The shift toward nutritional medicine appears inevitable despite institutional resistance, because let's face it, drug companies can't make any money on food. Patient outcomes create pressure that institutions cannot ignore indefinitely. Thousands of people are widely documenting dramatic health improvements through nutritional interventions and sharing those experiences. We're seeing a lot of that. So please understand, your doctor may not understand this yet because they're so busy doing what they're doing. But nutritional help really does work very well. But you got to do it for yourself. Economic forces will ultimately drive change. Healthcare costs are becoming unsustainable. Here's the big thing, right? You realize how much. So let's say you're working for a major corporation of some kind, and they're helping you supply your health insurance. It's becoming a bigger chunk of your paycheck, despite your company, no matter how good they are and how much they're helping. But here's the deal. Do you realize that something as simple as changing your diet can reduce your need for all kinds of medications and doctor visits, and that should be reflected in your healthcare costs, but a lot of times isn't because of all the other people that they have to pay for? So there are things you can do, but factor that in. As we get more and more to a point where our healthcare costs are likely going to bankrupt the government's ability to support it, you're going to be asked to do more and more in terms of getting healthy. Okay? And there are countries in the world right now, South Africa, for example, who are literally going bankrupt because of their cost for treating type 2 diabetes, because they offer a socialized medicine format They're picking up the entire cost, and such a high percentage of their population is now type 2 diabetic that it's becoming unmanageable, okay, for them. A simple 90-day elimination diet costs virtually nothing, because I'll tell you that switching from the normal standard American diet to a ketogenic carnivore diet costs virtually the same. You're just replacing junk foods with high quality nutrient dense foods, okay? My grocery bill when I switched did not go up. If anything, it went down, okay? And this cost is nothing compared to the cost of decades of diabetes medications and complications. And I was on diabetes medications for close to 15 years before I decided to get off of them, right? And get into this world of metabolic health. Trust me, I'm not paying for any of that medications anymore. The breakthrough will likely emerge from outside traditional academic medicine. Hey, hello. Direct pay practices, functional medicine clinics, and practitioners constrained by insurance reimbursement models. The insurance companies won't allow them to talk about this stuff, right? But I can. I'm not stuck by that. But once again, I'm not a doctor. I'm not diagnosing anything because there are strict rules on what doctors can prescribe, and I'm not a doctor, okay? A new generation of medical students, and I'm seeing them, witnessing these failures firsthand may prove more receptive to evidence-based nutritional approach than current practitioners investing in existing models. Sometimes some of the youngest doctors are the best informed for things, and that's also something to look for. The medical establishment faces a choice: adapt to acknowledging nutrition as a primary medicine, or become increasingly irrelevant to chronic disease management as patients find effective solutions elsewhere. The message remains clear for patients suffering now. The tools for healing exist today. They require stepping outside conventional systems and finding practitioners willing to use food as medicine. Patients who recognize this reality and take action will not need to wait for institutional change to regain their health. RFK Jr., love him or hate him, this is not politics, but he's changing the healthcare system for the better. He really is. And but it's going to take time for that to come from the top down. And you can do it today. Okay? The future of medicine is already available for those willing to seek it out. Thanks for watching. I appreciate it. If you can, leave a comment or a question in the appropriate area, and we'll answer them. If you have any idea for something you'd like to cover in a future episode, please tell me what you're looking for. This is a community. I'm here to try and provide you with information that you want to have. So thank you again. We'll talk to you soon.